of the medications that you find yourself de-prescribing, I'm sure one of them would be blood pressure medication. Is that?
Yes.
Do you see that?
Yes, absolutely. So that I'm really keen to get people off benjofluazide. It's a terrible drug. I mean, it's a drug that some people really need to be on if they haven't been able to tolerate some of the other blood pressure medications. But actually, benjofluazide can put your blood sugar up, so it makes no sense. First one, I'll try and take them off. Obviously glycoside as well. I think glycoside is a terrible drug because again that can actually make people more hungry. So I'm not a big fan of glycoside. Having said that, I should say this podcast obviously isn't medical advice, is it? So I wouldn't want anybody to stop their glycoside based on what they hear today. You know, it's obviously something they need to discuss with their own GP. But I personally try and get my patients off glycoside if I can, because it's not a great drug for various reasons. But yeah, blood pressure tablets, you're right. Often we do prescribe painkillers too, and that's because, you know, as people shed a stone or 2 stone or 3 stone, often their knee pain goes away. Hip pain too, general arthritis pains can go away, fibromyalgia pains can go away. The proton pump inhibitors that we use for acid reflux, so I quite like stopping those too.
Omeprazole is a common one.
Exactly, omeprazole and lansoprazole. So so often as people lose weight and they become more insulin sensitive, they don't need their proton pump inhibitors anymore, which has got to be a good thing, because actually they can really affect the way that people absorb their micronutrients. So that feels like a real win as well, getting people off those. My favorite de-prescribing thing though was a patient who I'd managed to get off his sleep apnea machine.
Amazing.
That was the best one.
But so what went on there then? How does low carb help a person with sleep apnea?
So that's basically losing some of the fatty deposits in his head and neck area, particularly the tongue, but also, you know, the jowls.
Yes.
So he lost a good couple of stone, this chap, and it was lovely actually. I was processing my letters and medication requests and blood tests and things one Friday evening, I think, still at work quite late. And it was, you know, nobody wants to be at work late on a Friday night, but I had this real sort of lovely feeling when I had several sort of letters and results that came back that were really sort of showing me how well this approach is working. And one of them was this lovely chap who he'd been to see the respiratory team, and his consultant said, Mr. So-and-so has decided he doesn't need his sleep apnea machine anymore, because since he's lost weight, he's sleeping and breathing normally. So fantastic. And the other good thing about him is that, you know, we've de-prescribed lots of medication for him and his wife as well. So his wife struggled with her blood pressure a lot. And since the two of them have done it together, you know, we've got her off her blood pressure tablets.